It's also a promotion. It's a Band 7 post.
Hello, Manong George here. Welcome to our channel. And today we have a very special guest.
My name is Shalom Lumenlan. I am a specialist nurse in organ donation. I have been here in the UK for roughly 10-11 years now, and I was an ITU nurse before I became a SNOD. We call ourselves a SNOD because it's a fact that specialist nurse in organ donation is quite a mouthful, isn't it? So to make everything easier, everybody knows us as a SNOD. But we are employed by NHS Blood and Transplant, and we do cover all London trusts in my line of work. And sometimes we even do cross-cover in other regions if needs be.
Manu knows best.
So our main responsibility as a SNOD is to support recently bereaved families, and empathetically discuss end-of-life care with them and the potential for organ donation. This includes talking to them, listening to them, acting as a punching bag sometimes, giving them all the right information and ensuring that they arrive at the best decision in this very distressing and highly emotive time. We also work closely with the multidisciplinary teams to encourage them and view organ donation within the context of end-of-life care, rather than just mainly for organ donation, if that makes sense. We also raised awareness of this wonderful gift to the general public and the staff.
Manu knows best.
My day is always changing. There's really no routine in this job, which makes my role quite challenging and interesting as well. There are days wherein I go to the unit, check up on my nursing colleagues, ask them, do they need support? Are they busy? Are they short? Do they need help with rolling a patient or relieving breaks? Sometimes we speak to a lot of doctors and consultants as well, ensuring that they refer all the potentials for organ donation, because fundamentally, we wouldn't know these potentials until they tell these potentials to us. There are also days wherein we do audits and data, wherein we check if we've got any missed opportunities, because every potential organ donor that the units refer to us is very, very important and very crucial, because the pool of potential organ donors is quite small within the UK. There are also days where we were on call, we support families, talk to them, support the units, make plans with the consultants and the nurses on how we can move forward in this process. If we get consent, we go to theaters and set the whole process up. So it's a very, very changing day every day.
Manu knows best.
It's more of a combination of my ITU skills and my love for just talking to families with regards to end-of-life care. My background is ITU. I've worked at the Royal London Hospital, and it is a major trauma hospital here in London. We have lots of dealings with organ donation, with SNODs, organ donation, specialist nurses in organ donation. And I think I have sat down with SNODs speaking to the families, and that kind of tickled me, and that was made me very interested in doing this job, because I know that it's a very different job. It's very different from a clinical setting, and it was just one of those things wherein one of the day when I was chatting with them, and I just thought, oh, I'm really interested in this. So I tried my best and I strived my best to apply for this job, and luckily I've got it. It's also a promotion. It's a band 7 post.
Manong knows best.
There's a training skill set that the organization would require you to know to be able to do this job, which you will learn in the process, because you will have a 6-month training period before you become a fully fledged SNOD. But I think the most important quality and skill that a SNOD should possess is the ability to communicate effectively. I know that sounds so simple, but we come across with all sorts of people dealing with grieving and angry families, dealing with difficult consultants that can sometimes may look down to you. There's some nurses who can become unbecoming to you whilst you're on the job. There are some pushy surgeons or coordinators that you need to deal with. And I think the ability to be able to manage that situation, ability to talk to them, ability to listen to them, and ability to change the mood without offending anyone and still manage to get what you need to be doing is quite something. I think it's also important that every SNOD should be very resilient, because our job is very intense. We deal with deaths every single day. We do have lots of breaking bad news conversation, and sometimes this can be emotionally draining for us, however resilient we are. And I think being able to bounce back on those very emotive situation is such a crucial thing, and is such a crucial skill that you would need to be learning to be able to be sane, really.
What's the process involved to become an SNOD then, please?
We are currently employed by NHS Blood and Transplant, or NHSBT, and we tend to have lots of job vacancies biannually sometimes. And I think the first and foremost thing that you need to do, if this is something that you would want to be pursuing, would be speaking to one of the team managers in your local trust in wherever region you are, and just asking them what the job entails. And then these team managers will be able to give you an insight or an oversight of what our role is. I think that's the most crucial part, because being a SNOD is such a unique role, and it's very, very different from the clinical setting. And you need to understand that it's a different nursing pathway, which is very good and challenging, but a good one in a good sense. We also tend to have webinars. I know it's very different at the moment, but we had seminars before, or now we're having webinars with regards to a day in the life of the SNOD, just to have a feel on what our work is all about. Doing something that is so unique, to be able to support a bereaved family in this highly emotive time, and making something good out of this very tragic situation. I think that's one of the most rewarding benefits of being a SNOD. Also, knowing that their loved ones' legacy is the gift of life is just special.
Manong knows best.
I think one of the challenges of being a SNOD is our on-call route. I won't lie, because we do have long on-calls, and now that everything, now that nationally is just getting busier, which is a good thing, it's just very tiring, really. And I think one of the challenges as well is the supporting a grieving family is not easy, and it's very intense and can sometimes be emotionally draining to a person. And I think being able to bounce back on that is quite good. And despite of this intensity that we have when we're dealing with families, we are still being supported like really, really hard by our managers.
Manong knows best.
You're passionate about organ donation or end-of-life care or just talking to families, and you see a job vacancy or an advert, just go for it. Don't be scared. You need to believe in yourself. I know that Filipinos have this tendency wherein they can be modest or humble, sometimes timid, can get intimidated sometimes, and the okay na to attitude. And I think we are living in a society wherein everyone has this equal opportunity to step up the ladder and to progress in their career. So I think it's very important to just believe in yourself, aim high, apply for the job. If you get it, that's great. If you don't get it, that's fine. And just use that as a learning experience for your next interview. Don't let anybody step down on you, look down on you, or dampen your dreams. Everybody has this opportunity, so grab for it. Remember, Manong knows.
Manong knows best. Put your worries to rest when staying in the United Kingdom. Manong knows best.